So chapter 8, I have our book. I'm going to read or review through the chapter with you all. Hospital Outpatient Prospective Payment Plan goes into the intro history of how hospitals used to work their payment systems. It's important to know how, this talks a lot about hospice. 60 days is the key time frame for hospice, is regarding billing and packages, if you will. Payment status indicators. So the OPPS payment status indicator is assigned to every HCPCS code. This indicator identifies whether the service identified is paid under the OPPS. So all of these acronyms, all of these initials, so much regarding government payment. So be sure and read that very clearly. Take notes, highlight, make sure you understand that. There's ambulatory payment classification groups also. I'm going to keep flipping. Calculation of the APC payment rate is important. I want you to review that. Pay attention to what they do cover, what they don't cover. So packaging, the next paragraph or section is packaging. It's important to know too what's contained in those service packages. Healthcare facilities need to make sure they are following coding, clinic, and best practices. Of course, throughout all of healthcare financing and billing, you should be following best practices. We don't ever want to commit fraud intentionally, unintentionally, because the ramifications are the same. You're going to get fined, possible imprisonment, etc. So best practices is always key, but there is coding requirements that we should follow also. Packaging types under the OPPS. You're going to need to know what's covered with the N, the S, the T, the X, all that different individual information for those, what package services are covered. Episode of care payment, that is discussed. Then we have a section with discounting, payment adjustments. So the OPPS co-insurance, that is important to understand also, because there has to be the intention is to protect the consumer from not being charged too much, but being charged unfairly. So there's a co-insurance maximum, that type of thing. So be sure and read through that. This page discusses new technology, corridor payments, etc. So then we get into the home health section of the prospective payment. Again, it starts with the history, how they used to do things. Now the fact that the certification must state that a face-to-face encounter took place within 90 days before home health care started, or within 30 days of home health care starting. So those type of little stipulations are important to know in healthcare finance and billing. OASIS on page 148. Important to know what type of or when data is collected for that type of billing, and there's payment of episodes. This entire page is going to be important to understand and grasp. Reread it, what have you. If you need any clarification, reach out to me. Next page, billing process, submitting a request for an anticipated payment. Transfer cases, what that means. Discharge, readmit. What all that means for hospice is important to know. Partial episode payment. Page 151, the low utilization payment. That section's important to know. You want to understand what happens if you don't use all of what's bundled in that package for that 60-day expectation. There's ways to handle that, and that is talked about and listed. Adjustments are discussed, continuing through. Home health prospective payment system consolidated billing, very important. What types of services are subject to that? That is listed there. Responsibility of providers, discharge planning. And then on page 153, you want to understand what the GPCI, what it stands for and what it means. And then you're going to also, everything in the chapter is very important, of course, but especially pay attention to what components are covered with the different labels as far as work, practice expense, market basket, that type of thing. And then the final piece of this chapter is an ambulatory surgical center section. Again, it goes into the history, what is expected with the ASC listings, and a nice conclusion for chapter 8. And that's it. You guys seriously reach out to me if you need anything.